Good afternoon. It is a pleasure to welcome you to the Harrisburg School District. As we think about the unprecedented time in which we live and the millions of school-aged children across the country and in the Commonwealth of Pennsylvania, this is quite a significant time as we prepare to welcome students back to school. It is a pleasure to introduce an individual who is committed to ensuring that students across the Commonwealth are not only well educated, but educated in a safe and healthy learning environment. Please join me in welcoming the Secretary of Education, Dr. Noe Ortega.
Thank you, Dr. Samuels, and thank you everyone for joining us today and for hosting us today as well. Thank you to the Harrisburg School District and your community partners for creating multiple opportunities for your students' families to receive the free COVID vaccine, or COVID-19 vaccine. The mobile COVID-19 vaccine clinics, like the one going on right now at your elementary school down the street, are vital as we continue to fight this pandemic. And as students, teachers, and staff prepare for the new school year, which is quickly approaching us. As educators, we know our students learn best in the classrooms. We also know that schools are a great place for our students and their families to get the COVID-19 vaccine as well. As communities across the Commonwealth prepare for a new school year, we must work together to create healthy and safe conditions for our students, our teachers, and our staff now and well into the future. We're so proud of the more than 100,000 teachers who answered the call earlier this year, in fact this summer, and lined up to get the COVID-19 vaccine in Pennsylvania. This practice is something that's being emulated and talked about in national circles as well. And we're so grateful to the students and families in line now, here in Harrisburg and across the Commonwealth, to get the COVID-19 vaccine as well. On behalf of the Wolf Administration, the Department of Education, thank you Harrisburg School District for mobilizing and creating pathways to the COVID-19 vaccine for your community. I encourage everyone who is eligible to get a COVID-19 vaccine as soon as possible to do it. It helps keep our kids, our students, our teachers, and staff safe in school. While this pandemic has changed all our lives, I stand here today with tremendous hope and optimism for the future. Our school communities continue to go to great lengths to serve and support Pennsylvania students who are our future. And for that, I thank them. And I thank all of you for doing your part to help keep our students and our school communities safe. It is my honor now to invite my colleague, Dr. Sherry Smith, PDE's Acting Deputy Secretary for the Office of Elementary and Secondary Education, to the podium to also provide everyone here in attendance a few remarks as well. Dr. Smith.
Good afternoon, everyone. Thank you, Secretary Ortega, and members of the Harrisburg School District for allowing us to be with you here today. I'm truly honored to be here after 33 years in the field of education. It's just heartwarming for me to get back into schools and to school buildings and to think about our students coming back to school for this coming year. It's like coming home for me. So vaccinations has been proven to be one of the most effective strategies we have for mitigating the spread of the COVID-19. And as we look at our schools and presenting and providing the opportunities for our students and our staff to come in and get those vaccinations, we can only applaud the work of those schools to do that, because again, it is definitely a strategy that they found to be most effective with the COVID-19. So in addition to that, we have other layered strategies that we need to put into place in our schools and our health and safety plans as we follow the CDC guidance in doing so. We also want to talk about some things the department has been doing to be able to support our schools in this coming year with returning to the classroom, with the academic gaps, the social and emotional learning that our students need as we come back to a safe environment. So part of our work, and the ones that I'm most proud of, is our accelerated learning work that the members of our department, in concert with our intermediate units in Patam, put into place, where we talk about academics, social and emotional learning, scaffolded supports for our students, such as summer learning, academic supports in this after-school programs, tutoring programs, and within our classrooms over this next year. In addition to that, we have $5 billion of ESSER funds that we have provided for our schools, that provides the dollars for our schools to mitigate some of those academic and social and emotional learning gaps, as well as provide other opportunities for school, whether they're facility upgrades, as well as supports for our schools moving forward. And for that, we're very thankful that we have those opportunities for our schools. But most of all, I want to thank educators and schools for everything they have done over the past year and a half to continue to try to take care of our students in unprecedented times. We need to continue that hard work and dedication as we move into this next year. It's not been easy for any of us, whether it's our students, our families, or our educators. But if we all work together, we can get back to the business of educating our students across the Commonwealth. It's a new year, albeit we still have a pandemic that we all need to manage, and there's continued challenges ahead of us in managing a new academic year. But I hope we can enter the start of the school year with a level of enthusiasm and renewal. Thank you. It's time to turn it back over to Dr. Samuels.
Thank you. In the Harrisburg School District, we remain mindful of the devastating impact of COVID-19 and the devastating impact that it's had on our children, families, and the broader community. As we continue to focus on the importance of health and safety, we have proudly partnered with UMPC to provide information and the Hamilton Health Center, a local federally qualified health center, to provide free vaccines and educational resources for residents at various Harrisburg School District locations. There's actually an event that's happening today, and we really want folks to take advantage of that. And I'd like to take just a moment to, on behalf of the entire Harrisburg School District, we'd like to thank Ms. Janine Peterson, who is the Chief Executive Officer of the Hamilton Health Center. It is because of Ms. Peterson that throughout the month of July and much of August that the vaccinations have been made available to students, families, and to the broader community. And that says an awful lot. We are anxious to get students back in classrooms, and we want to do it in a very, very safe and a very, very appropriate manner. And as a school district, we continue our commitment to promote safety and to mitigate the risks associated with the spread of COVID-19. And we would really like to encourage everyone who's available to take advantage of the opportunities of the vaccinations that have been provided and to really support safety measures so that students can return to schools. And on that note, I would love to welcome and invite Secretary Ortega to return to the podium. Thank you all so very much.
Thank you. At this time, we'll take a few questions from members of the media. Tracy, will you help me sort of call on folks as they raise their hand for a question? Please. Sure, I appreciate the question. I'll repeat it as well. With regards to a statewide mandate, if there is intention of the state or rationale behind their decision not to mandate masks, I want to be very clear that the Pennsylvania Department of Education, along with Department of Health, throughout the past year and a half with regards to guidance, has really emphasized the role of this being a local decision, recognizing that the contexts vary among the various counties and communities across Pennsylvania. We are, however, recommending that schools align themselves with the CDC with regards to their recommendations at the moment. They are recommending that masks be used by students in the classroom and teachers and educators as well, regardless of vaccination status, but it's not the only mitigation strategy that they're recommending. Vaccines, which is why we're here today as well, are part of that, along with other things in terms of social distance, cleaning protocols, as well as monitoring surveillance as well.
You mentioned 100,000 teachers have been vaccinated that lined up. I believe 100,000 was the number you used in your remarks. How many teachers are there, public school teachers in the state? What percentage is that 100,000?
Sure, let me invite Dr. Smith to share a little bit with regards to, we may not have the exact figures, but it'll give you a sense of the buy-in and support from our educators as well. Dr. Smith?
Yeah, thank you. Unfortunately, Dennis, I do not have that answer for you this morning, exact number of teachers, but I would say we probably hit about 70% of our teachers during that effort last year. But let's not forget that we also have teachers that have gone through private providers and such for vaccinations. So we may not have an exact number of how many teachers are actually vaccinated.
Secretary, just to be clear, because I've heard the concept of a Commonwealth cited as the reason why there's no statewide mask mandate multiple times. Just to be clear, is it the administration's belief that you guys don't have the ability to implement a statewide mask mandate, or that you're just choosing not to?
Sure, I don't speak on behalf of the governor and the administration in terms of what they feel they have the agency to do, but as the Department of Education and the role that we have with the Department of Health, we've gone back and forth with regards to understanding what the best approach is going to be, what the science is telling us, and then what's already available from a federal sort of guidance in terms of the CDC, right? And it's our recommendation that we align ourselves to what's being done with the CDC. In terms of authority, this is really authority rested at the local level in school boards where the decision is happening, right? And so for us, the agency has always rested there in terms of what's being done. And the state sort of weighs in when there's a need to move into a certain direction. And so where we are now, as opposed to where we were 16 months ago, we know a lot more about the vaccine. Certainly we don't know everything, but we know a lot more, and we understand what has been working, what has not worked, and so we're aligning ourselves to some of those recommendations by and large.
What do you make about the fact that we've had several school districts, a lot of school districts really, probably more than several in our area, saying, within the last few weeks that they're going to reverse course on making masks optional, and now they're going to require them?
Sure, again, I want to respect the difficult decisions that our school leaders are making. And I think as the folks begin to monitor what we're seeing in terms of transmission, but also the behavior that you see happening in other states, right? The nice thing, I wouldn't say nice in terms of it occurring, but the idea that you've got examples of what other states, particularly some who have begun school as well, are doing. It gives our school leaders what they need in terms of evidence, in terms of decision making as well. And so, these are going to be challenging decisions, but we know that we provide as many resources, and Dr. Smith and her team have been working to make sure that we don't put out what we're calling guidance, but certainly providing folks with information and resource. I'm not sure if you want to add anything to that, Dr. Smith.
Just, I think a lot of the schools are revisiting their health and safety plans based on their regions moving back to substantial transmission of COVID. So, as we learned last year, as the conditions change within communities, so may be the way that we layer our strategies as laid out by the CDC to prevent spread of COVID in the classrooms.
Victoria Lucas, Fox 43.
Yes. I don't know if this is a question for Secretary Ortega or Superintendent Turman, but I do have a question about the reported numbers of kindergarten students and their enrollment expecting to be in this coming fall. So what is the school district going to do to help these kindergartners acclimate, and especially in safety terms, because they're not allowed to get the vaccine yet? And also, what is the district wanting from the state to help the students and also their teachers?
Do you want to speak to the
Do you want to take from a Harrisburg perspective first?
So from a Harrisburg perspective, from the very beginning, we focused on health and safety of all of our students, our staff members. And so as we begin to bring children back, we will bring children back, and I have chosen to, we're doing masking. And when you think about bringing children back to school for the very first time, we're working diligently with our staff members, our teachers, our building leaders, to really support students. Bringing students back to school in all grades is very different this year because of what's happening, and we're cognizant of that. We're looking at the social emotional aspect, and to do everything that we can to ensure that students are comfortable and that they're safe. This is about doing what's right for students and focusing on safety and health of everyone.
And are you asking anything from the state? parents and the community to help at all in any way?
The community has been very positive and very supportive. Again, from the very beginning, when we brought students back in the spring, we're taking that same stance. As I mentioned, our health and safety plan is quite clear, and we're not deviating. We're not pivoting on this. We're following CDC guidelines. And the same, support from the state and from the Department of Education that we've received, we're expecting the same thing, that they do support the decisions that are being made here in the Harrisburg School District as we focus on the safety and welfare of all of our students.
And then just to layer on from the state perspective, and I'll let Dr. Smith as well provide some insight. Schools, in terms of requests coming from the state, obviously resources are required to make sure that students, when they come back to learn in person, have what they need to create a conducive learning environment. Either safety, that some of the federal dollars coming to our schools can be used for, but in addition to that, resources around mental health and well-being. We understand, particularly with our young learners, that they were disproportionately affected by the shuttering that occurred with regards to in-person and remote learning. And so for some young kids, the opportunity to come back for face-to-face learning is going to be really important. So Dr. Smith and her team have devoted a lot of time to getting a lot of those resources up and running.
And all that is again, through the Accelerated Learning Toolkit, one of the key areas is the social and emotional learning part of it. And whether kindergarten, first grade through 12th grade, all our students coming back. We're concerned about the fact that they come back and feel safe in their environment. And we can assess, just as we need to do with our learning gaps, is look if there's any social and emotional gaps with students and provide them the additional supports to make them feel safe, happy, rebuild relationships with teachers and fellow students in the classrooms, and make this a positive school year for all.
Secretary, we saw a pretty big announcement today from the health department about nursing homes and getting, trying to encourage those facilities to get everybody vaccinated. My question to you is, are we going to see any kind of similar expectations or benchmarks being set for schools, especially given that, there are a lot of immunocompromised students, teachers, staff, potentially, depending on the school district or school, even more than, these nursing home centers might have. So could you give us any idea if there's anything in the works to try and create any benchmarks or ways to encourage the vaccination rate to be higher?
Yeah, and today we're here for one of the initiatives that has been launched by the Department of Health in partnership with the Department of Ed to have mobile vaccine clinics, right? The goal here is to make it as readily available to all folks by even going into the schools that are willing to invite the vaccine or host a vaccine clinic as well. We're going to continue to do the push in partnership with all our agencies around the importance of getting vaccinated. We understand that we have a very different problem now than we did at the beginning, right? At the beginning was availability, and now it's the need to make sure that individuals understand the importance and the role that vaccines are going to play to allow us to continue to provide in-person learning for our students, right? One of the things that I really want to emphasize is while school leaders are doing tremendous amount of things to make sure that they create the safe learning environments for our students by implementing mitigation strategies, encouraging their educator and personnel to be vaccinated, they're still entrenched in communities. And communities must do the same thing in order to ensure that young kids, whether they're the kindergartners that we were being asked about, or the middle school or secondary school students, if we do our part as well, if we vaccinate as community members, it will ensure that we can continue to provide face-to-face instruction to our students. And I think that's an important takeaway as well.
Last question will go to ABC 27.
Can you tell us, so if you're over 12, you can get the vaccine. Do you have any idea on numbers of the kids that are still school age, but 12 and over, who have gotten the vaccine? Is it something that is being embraced in the state? Do you know? Do you have any? Can you quantify it for us? Or are there a lot of parents that still seem squeamish and hesitant to have their kids get the vaccination?
Yeah, so I don't have the same numbers that the Department of Health has around people showing up to get vaccinated, but we do have, at least Dr. Smith and I, the anecdotal evidence of schools telling us that young people are coming out, that parents are encouraging their children to get vaccinated as well. Is there vaccine hesitancy in terms of the question as well, which is an underlying premise? I would imagine that young folks are very much influenced by the discussions that we have as adults or that are being had in sort of public spaces. And that's one of the things that we're trying to really work hard to really push back by creating a positive narrative on the importance of vaccines, right? So while I can't answer specifically what the uptick is in terms of folks, in terms of data that we have collected, and I think DOH may be able to provide, I can say that in many cases it's being received well among those who are eligible for the vaccine. Thank you. Thank you, everyone. Thank you. Thank you.
Thank you very much for joining us today. Have a great day.